on the 19th of September.
What the hell is wrong with you?
What is wrong with you?
Reynolds, the Director of Public Affairs here at CDC. We'll be hearing briefly from 4 speakers and then take questions from the media. Our first speaker is CDC Director Dr. Tom Frieden.
Good afternoon, everybody, and thank you for joining us. As you've been hearing from us, Ebola is a serious disease. It's only spread by direct contact with someone who's sick with the virus, and it's only spread through body fluids. The incubation period is 8 to 10 days after exposure, can be as short as 2 days or as long as 21 days. It's a severe disease which has a high case fatality rate even with the best of care. But there are core, tried and true public health interventions that stop it. Today, we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States. This individual left Liberia on the 19th of September, arrived in the U.S. on the 20th of September, had no symptoms when departing Liberia or entering this country, but 4 or 5 days later, around the 24th of September, began to develop symptoms. On the 26th of September, initially sought care, and Sunday, the 28th of September, was admitted to a hospital in Texas and placed on isolation. We received in our laboratory today specimens from the individual, tested them, and they tested positive for Ebola. The state of Texas also operates a laboratory that found the same results. The testing for Ebola is highly accurate. It's a PCR test of blood. So what does this mean? The next steps are basically threefold. First, to care for the patient, and we'll be hearing from the hospital shortly, to provide the most effective care possible, as safely as possible, to keep to an absolute minimum the likelihood, the possibility that anyone would become infected, and second, to maximize the chances that the patient might recover. Second, we identify all people who may have had contact with the patient while he could have been infectious. And remember, Ebola does not spread from someone who's not infectious. It does not spread from someone who doesn't have fever and other symptoms. So it's only someone who's sick with Ebola who can spread the disease. Once those contacts are all identified, they are all monitored for 21 days after exposure to see if they develop fever. If they develop fever, then those same criteria are used to isolate them and make sure that they are cared for as well as possible so that they maximize their chances and to minimize or eliminate the chance that they would infect other people. The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here. It does reflect the ongoing spread of Ebola in Liberia and West Africa, where there are large numbers of cases. And while we do not currently know how this individual became infected, they undoubtedly had close contact with someone who was sick with Ebola or who had died from it. In West Africa, we are surging the response not only of CDC, where we already have more than 130 people in the field, but also throughout the U.S. government. The President has leaned forward to make sure that we're acting very proactively there, and the Defense Department is on the ground already strengthening the response. We're working with USAID and other parts of the U.S. government, as well as with a broad global coalition to confront the epidemic there. But ultimately, we are all connected by the air we breathe, and we are invested in ensuring that the disease is controlled in Africa, but also in ensuring that where there are patients in this country who become ill, they're immediately isolated, and we do the tried and true core public health interventions that stop the spread of Ebola.
Thank you, Dr. Frieden. I'd like to next introduce our second speaker, Dr. David Lakey, Commissioner of the Texas Department of State Health Services. Dr. Lakey.
Good afternoon, everyone, and thank you, Dr. Frieden. Thank you for your support, the support of the CDC as we work through this current situation. As I start off, I first want to say our thoughts and prayers are with the family, with the patient, and the treatment team for this individual. Our laboratory, the Texas Public Health Laboratory in Austin, has a specially trained team to handle high-risk specimens like this. We were certified on the 22nd of August to do Ebola testing. At 9 o'clock this morning, we received the blood sample. All the controls were within the expected ranges, and the PCR was definitely positive for Ebola Zaire, and we got that result back at 1:22 this afternoon. I want to reiterate that we have no other suspected cases in the state of Texas at this time, but we are closely monitoring the situation, and we're ready to assist in any way that is needed. We've been in significant contact with the hospital, with the local health department, and the CDC, and they have our full support as we work through this situation, and we're committed to keeping Texas safe. So again, I want to thank the CDC, the local health department in Dallas County, and the hospital for the work that they're doing, and we're working through this situation together. Thank you.
Thank you, Dr. Lakey. Our third speaker is Dr. Edward Goodman, the hospital epidemiologist with the Texas Health Presbyterian Hospital, Dallas. Dr. Goodman.
Thank you, Dr. Frieden, Dr. Lakey, and the CDC. I want to correct one statement that may have been misinterpreted by Dr. Frieden when he commented on the air we breathe. Ebola is not transmitted by the air. It is not an airborne infection. Texas Health Dallas is a large community hospital with a robust infection control system that works in close cooperation with the Dallas County Health Department, the Centers for Disease Control, as well as other epidemiologists within the system and in the community. We have had a plan in place for some time now in the event of a patient presenting with possible Ebola. Ironically enough, in the week before this patient presented, we had a meeting of all the stakeholders that might be involved in the care of such a patient. And because of that, we were well prepared to deal with this crisis. Thank you.
Thank you, Dr. Goodman. Our final speaker is the Dallas County Health and Human Services Director, Zachary Thompson. Director Thompson.
Good afternoon. Our hearts and prayers go out to the family as well. I want to thank Dr. Frieden, CDC, Dr. Leahy, Department of State Health Services, as well as Texas Health Presbyterian for our response to this case in Dallas County. I also want to commend Dr. Christopher Perkins, our Medical Director, Health Authority, and our EPI team for their work that they have been doing in conducting public health follow-up on the patient, which includes contact investigation to gather information based on the patient's travel history, activities, and close contact. Dallas County Health and Human Services will proceed with the public health follow-up per CDC guidelines. And Dallas County Health and Human Services wants Dallas County residents to be reassured that your public health is our #1 priority. Dallas County Health and Human Services staff will continue to work hard to protect the health and welfare of the citizens of Dallas County. Thank you.
Thank you, Director Thompson. We'll now take questions. Dr. Frieden.
Thank you very much. And for questions, we'll start in the room and then go to the phone. I thank you very much also for that comment, Dr. Goodman. As emphasized, Ebola only spreads by direct contact. It does not spread by any other route that we've seen in any outbreak. I also want to thank Texas and Dallas County Health Departments for their collaboration. CDC has a team of epidemiologists en route to Texas now at the request of the Texas Department of Health, and we work hand in hand, collaboratively, to do what public health does best, which is protect people. And we protect people in this case by making sure that we find the contacts, identify them, and make sure that they're traced every day for 21 days. And if they develop a fever, that they're immediately isolated, and then their contacts would be identified as well. So first question in the room.
Denise Stone from Fox 5. So you were saying that he started showing symptoms, went to a hospital, and then was released, sent home, and then was not admitted until a day or two later? Is that correct?
The initial symptoms of Ebola are often non-specific. That means there are symptoms that may be associated with many other conditions, so may not be immediately identified as Ebola. And that's why we have encouraged all emergency department physicians to take a history of travel within the last 21 days. That's something to reiterate, and then to do rapid testing. Dr. Goodman, is there anything more that you'd like to say about it?
No, I think you summarized it very well.
Thank you. Next question in the room.
Dr. Frieden, I know you're limited a little bit with patient privacy, but can you tell us a little bit, was this person involved in fighting the Ebola epidemic, and also did they travel on a commercial aircraft? Rachel from WSB TV.
From the information that we have now, it does not appear that the individual was involved in the response to Ebola, but that's something that we will investigate more. In terms of the airline flight, I really do want to emphasize the focus here over the next period needs to be the patient, and we're very focused on trying to get any assistance we can to the patient who we understand is critically ill at this point. And then identifying contacts in the community, family members or others, and then any possible contacts through the healthcare setting, and then tracing those contacts. In terms of the flight, I understand that people are curious about that and wonder about it, but remember, Ebola doesn't spread before someone gets sick, and he didn't get sick till 4 days after he got off the airplane. So we do not believe there's any risk to anyone who was on the flight at that time.
So it was a commercial aircraft?
He left on the 19th and arrived on the 20th. Next question in the room.
Hi, Michelle Alloy from WABE. How likely is this to continue to be a concern with people coming back from the region who aren't showing symptoms then but may later, and what is being done at airports and sort of the first lines of people coming into the country to ensure that something like this doesn't continue to be an issue?
As long as there continue to be cases in West Africa, the reality is that patients travel, individuals travel, and as appears to have happened in this case, individuals may travel before they have any symptoms. One of the things that CDC has done in Liberia, Sierra Leone, Guinea, and Lagos is to work with the airport's authorities. So 100% of the individuals getting on planes are screened for fever before they get on the plane. And if they have a fever, they're pulled out of the line, assessed for Ebola, and don't fly unless Ebola is ruled out. This is one way to make sure that the airplanes themselves are safe during transit and the airlines are willing to keep flying. But that doesn't rule out a situation like this one where someone may have been, was exposed and then came in while they were incubating the disease but not infectious with it.
Janice McDonald from ABC. Can you tell us where he was, and do you know why he was in those countries?
The details of the individual are things that we will investigate, and some of that has to do with patient confidentiality, so we would defer to the hospital and to the family for any further information on those details. We have a question here, and then shall we go to the phone for the first question after this one?
Yes, Doug Stoddard from NBC News. Do you expect the patient to remain in Texas and be treated there, or transferred to facilities such as Emory or one of the other specialties around the country that have been treating them in the past?
So one of the things that we really do want to emphasize is that virtually any hospital in this country that can do isolation for Ebola. In fact, over the past decade, although this is the first Ebola patient in this country, we've had 5 patients with other forms of very deadly viruses, what are called viral hemorrhagic fevers, or 4 of them Lassa fever, 1 of them Marburg. None of those 5 patients spread the disease to anyone who cared for them in the hospital, even though they weren't promptly diagnosed because it was such an unusual situation. So we don't see a need from either a medical or a infection control standpoint to try to move the patient. Dr. Goodman, is there anything more that you'd like to say?
No, I think that summarizes it very well.
On the phone?
To ask a question by phone, please press *1 and record your name at the prompt. The first question is from Miriam Thaco of CNN News. Your line is open.
Hi, thanks for taking the call. Can you tell us a little bit more about how sick the patient is, how the patient is being treated, and how many contacts you are trying to reach? That might be something for the folks in Texas. And also, will this patient be staying at the hospital in Dallas?
So let me turn first to Dr. Goodman, if any information that you can share about the patient's status and treatment.
Well, because of the patient privacy, we're unable to share any information about the patient's symptoms or his treatment at this time. I can say that he is ill, he's under intensive care, he's being seen by highly trained, competent specialists, and the health department is helping us in tracing any family members that might have been exposed.
And Director Thompson, do you want to say anything further about contacts?
Well, I want to echo that our staff has been doing the public health follow-up since day one, and so we'll continue that process, and we'll have more details in days to come, but right now everything is going fine. Thank you.
Thank you. And as I mentioned earlier, we have a team en route to Texas now. They will work hand in hand with state and local and hospital public health and epidemiologic staff to identify all possible contacts and then monitor them every day for 21 days to see if they have fever. This is core public health work. This is what we do in public health, and we're delighted to be doing it in partnership with Texas. We're very concerned, obviously, about the status of the patient and very much hoping for his recovery. On the phone?
The next question comes from Betsy McKay of the Wall Street Journal. Your line is open.
Hi, thanks. I just wondered if I could ask a little more detail about potential exposures. Do you have, is there anything that any of you could say more about what this patient was doing between the 24th when he had symptoms and the 28th when he was admitted? I mean, was he just at home and so only family members were potentially exposed, or how many people, or was he out? I mean, are we talking about a handful of people who were potentially exposed, or more than that, or dozens?
Well, I think handful is the right characterization. We know that there are several family members. They may have been 1 or 2 or 3 other community members, and we're there to do additional investigations to identify any other possibilities. Our approach in this kind of case is to cast the net widely to ensure that we're identifying even people who may not have had direct contact, so that we're erring on the side of safety. Mr. Thompson, anything else you would like to add?
I concur. Our role is to look at suspected cases, and we really appreciate, Dr. Frieden, you sending your CDC EPI team down to support us in this effort. We think, again, it's a small framework that we're looking at in terms of the number of people, but once we get additional information, we'll report out to the public.
And I would comment that this is a tried and true protocol. This is what we do in public health. It's what we do in this country for a variety of infectious diseases, and it's what we do at CDC globally in Ebola cases. In fact, by coincidence, today we released in the Morbidity and Mortality Weekly Report, our weekly bulletin, a report of the Nigeria case investigation where a single patient came in. Unlike this, that individual was not cared for with infection control and resulted in a number of secondary cases. But even in Lagos and even with 19 secondary cases, they appear to have been able to stop the outbreak. I have no doubt that we'll stop this in its tracks in the U.S. But I also have no doubt that as long as the outbreak continues in Africa, we need to be on our guard. Other questions in the room?
Lauren from WXIA. Can you give us a number or just a scale of how big this team from the CDC is going to be and who that directly entails? Are these doctors that are going to be in the hospital, or are these going to be people who are actually like fanning out into the community? Can you give us a little bit more information on that?
I can get back to you with the exact size of the team. We provide epidemiologists or disease detectives. We provide communications experts. We provide hospital infection control and laboratory experts as needed in the situation. And every CDC staff who's there, or the 130 who are in Africa, are tied tightly to our experts here who provide backup 24/7. We defer to the local and state health departments, and they're there on the ground, they're the lead, and we're there to support. In the room? On the phone?
The next question comes from Lauren Neergaard of AP. Your line is open.
Thank you. Do we know, can you even say if this is an American or is this a visitor? And then has the health department already reached any of those contacts? Has that contact tracing begun?
What I can say is the individual was here to visit family who live in this country. The further details, I think, are to be identified in the coming days, or relevant or not, we'll see. In terms of contact tracing, we're just beginning the process since investigation just began today, but the health department had already been very forward-leaning on that.